The UK has reported 917 new COVID-19 fatalities in the past 24 hours, while many people appear to ignore the risks posed by the virus. Iran has started mass production of testing kits for the COVID-19 virus. St. Vincent and the Grenadines has received 3,000 COVID-19 rapid test kits from Venezuela as another example of international solidarity amid the coronavirus pandemic. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. Spain, one of the worst affected countries by the coronavirus pandemic, on Saturday reported a fall in its daily COVID-19 death toll for a third consecutive day.
The total number of deaths is 16,353, and the number of deaths recorded yesterday was 510. 4,830 new cases, bringing the cumulative total of cases since the beginning to 161,852. Based on these figures, and as we have commented yesterday and in the previous days, the increase in the number of cases is 3%. And as we have already observed, especially in the last 2 weeks, we will continue this downward trend.
Despite the restrictions imposed in the United Kingdom to stop the spread of the novel coronavirus, many people appear to be ignoring the risks. As the weather gets better, many residents in London have taken to parks to walk and exercise without wearing protective masks or practicing social distancing. The UK has reported 917 new COVID-19 fatalities in the past 24 hours, bringing the country's death toll to almost 10,000. The number of confirmed cases has reached 73,758.
Sadly, 9,875 people have now died, an increase of 917 on yesterday. Sadly,
the coronavirus is disproportionately killing Black, Asian and ethnic minorities in the United States and the United Kingdom. More details in the following report.
What we're seeing from the statistics is that people from Black and minority ethnic backgrounds constitute nearly a third of COVID deaths so far in Britain. Now, given that they make up only 13% of the population, that means if you're Black or minority ethnic, you're at least twice as likely to die from COVID than if you're white. And we're seeing the same in the US. For example, if you look at the map of New York City and where the biggest outbreaks have been, the situation is really stark. It's the Bronx, it's Harlem, it's Queens. These predominantly African-American and Latino districts are massively overrepresented in the coronavirus statistics. Now, the reason for the disparity is clear enough, both in Britain and in the United States. We're talking about centuries of entrenched, institutionalized racism, which mean that people from ethnic minorities are much more likely to be poor. They're much more likely to be in a situation where they have to continue going to work in spite of a lockdown. They're much more likely to suffer from long-term exposure to air pollution, more likely to suffer from the various underlying comorbidities that are associated both with poverty and with high susceptibility to COVID, particularly heart disease, particularly diabetes. This perhaps gives us a hint as to why the British government was pursuing a strategy of so-called herd immunity, letting everybody get the virus. If this was something that mainly affected wealthy white people, I quite strongly suspect that serious containment measures would have been put in place a very long time ago. However, the instincts of a hard right Tory government are obviously not to prioritise saving the lives of Black and low-income workers.
We're taking a very short break now, so don't go away. Welcome back to From the South. Iran has started mass production of testing kits for the COVID-19 virus. The diagnostic kits are capable of identifying patients who have been exposed to the coronavirus by analysing their immune response. 6 companies have been approved to manufacture the kits and are expected to produce 2 million every week. Iran has so far reported around 70,000 confirmed COVID-19 cases and 4,357 deaths.
We have 2 types of test kits. One of them is a serology-based test kit that can precisely diagnose those patients who had been infected by the coronavirus before even those who showed no symptoms of the disease at all. We have a second test kit that can quickly identify infected cases too. We started mass production, of which 3 weeks ago we are producing 100,000 of those kits weekly, and they are already on the market.
One doctor has died and more than 600 health workers have been infected with the novel coronavirus in Turkey. With the growing number of cases in the country, health workers have been working flat out to treat patients as hospitals become overwhelmed. Istanbul, Turkey's largest city and the biggest in Europe, is the epicenter of the COVID-19 epidemic in the country, with more than 60% of cases. Turkey has seen over 52,000 coronavirus cases and more than 1,000 deaths.
Evet, 600'den fazla sağlık çalışanı enfekte oldu. Bizim kurumumuzda da var. Yani 70'ten fazla sağlık çalışanı da bizim kurumumuzda enfekte oldu. Onlarla da birebir ilgileniyoruz, konuşuyoruz. Hem teşhis tedavilerini takip ediyoruz hem de onlara psikolojik destek oluyoruz. Zor bir şey bu ama atlatacağız.
Businesses have reopened in Bahrain after the government lifted measures to curb the COVID-19 virus. Compared with the rest of the Gulf region, Bahrain has reported a relatively low number of COVID-19 cases. The country has reported 887 cases and 5 deaths. However, strict norms, including the wearing of protective masks and social distancing, will remain in place despite the lifting of the lockdown.
Shops have been closed for 14 days because of coronavirus. Last night at 7 in the afternoon we were allowed to reopen the shops. Right now we are getting less customers, however, the situation is still fine in Bahrain. Not a big issue though, it's fine, thank God.
The Ivory Coast has been hit by protective mask shortages as the country battles to contain the COVID-19 epidemic. People are struggling to obtain the masks required to protect themselves from the coronavirus in the city of Abidjan, the economic capital of the country. The city has already been placed under lockdown after reporting hundreds of confirmed cases. The government has pledged to bail out mask producers so that they can continue to work to meet the demand. The West African country has reported 444 confirmed cases so far, while 3 people have been killed by the disease.
At the pharmacy, I had a hard time getting one. I went to several pharmacies. Finally, I got one. But in the end, I couldn't find any more. So now I turn to these little girls on the street selling masks.
And it's a different story in Morocco, where the mask production industry is booming. Several companies are converting their normal production lines in order to manufacture protective masks. Morocco is one of the most affected countries by the pandemic in Africa, with 1,527 confirmed cases and 110 fatalities.
Heureux et fier aujourd'hui de vous dire que la société a réussi à convertir ces machines qui fabriquaient des sacs en machines qui fabriquent des masques grâce au génie, à l'ingéniosité, au travail, aux efforts acharnés de l'équipe, de l'ensemble de l'équipe, de l'ouvrier, du technicien, de l'ingénieur qui se sont bataillés jour et nuit sur les 2 dernières semaines pour arriver à...
And moving on to another deadly disease, the first person to contract Ebola in the Democratic Republic of Congo in more than 50 days without a reported case has died, ending hopes that the second worst outbreak of the disease in history might be over. The country planned to declare an end to the epidemic on Sunday, which could have allowed its overstretched health service to concentrate on containing the novel coronavirus, which has infected 215 people and killed 20. The new Ebola case, the first since February 17th, was a 26-year-old man from the area of Beni, a town in eastern Congo, who developed symptoms on March 27th and died in hospital on Thursday morning. And we're taking a final break now, but stay with us for more. Welcome back to From the South. And this Good Friday, St. Vincent and the Grenadines received 3,000 COVID-19 rapid test kits from Venezuela. Prime Minister Gonçalves and Minister of Health, Wellness and the Environment, Luke Brown, received the kits at the Argyle International Airport. Venezuela is sharing medical supplies with its Caribbean neighbours, having itself received donations from China, Russia and the United Nations. St. Vincent and the Grenadines has reported 12 confirmed coronavirus cases so far.
I want us to get this. Venezuela is in a very difficult economic position. Venezuela is in a political situation with threats to its independence and sovereignty, where there are forces in our hemisphere threatening regime change and seeking to undermine lawful authority in Venezuela, creating the circumstances of facilitating a condition for social and political unrest. Venezuela has its own challenges with COVID-19. They have been able to acquire a certain number of the rapid tests, these kits, and also the reagents. And instead of keeping all for themselves, they are sharing with us and Dominica and Grenada and Antigua and Barbuda. I think this is wonderful.
St. Lucia confirmed one new positive COVID-19 case on Friday.
There are now 454,710 confirmed cases in the region of the Americas. On Friday, April 10, 2020, St. Lucia confirmed one additional case of COVID-19, bringing our national total to 15. A total of 24 samples were tested, with 1 positive and 23 negatives.
Prime Minister of Belize, Dean Barrow, has said that Cuba is perhaps the world leader in terms of international solidarity. There are currently 58 Cuban medical professionals working in Belize.
The self-sacrifice of you and of the people and government of Cuba has now become a matter of legend, and it is fair to say that Cuba is perhaps the world leader in the area of international solidarity.
Argentina's government has extended a lockdown imposed to halt the spread of the coronavirus. It was initially supposed to end on April 12th, but will now run until April 26th.
We're going to extend quarantine until April 26. We'll reassess it on April 27. You must understand that we are in a very fluid scenario. You must understand that lifting the quarantine depends a lot on what each of us does. That is why I want all of us to be responsible to be able to lift the quarantine. So the best way to get out of the quarantine is to strictly observe it, all right?
In Ecuador, which has seen a crisis sparked by the numbers of COVID-19 deaths and the lack of funeral services, citizens in the Monte Sinai area of the city of Guayaquil, the epicenter of the epidemic, have rejected the construction of a cemetery in their neighborhood. More details in the following report.
The mayor of Guayaquil City announced that she had recovered from the COVID-19 and is returning to the area. She said the cemetery is built to handle the sanitary crisis will hold 12,000 tombs that will be used not only for the pandemics, but also for those who die of other diseases.
We are quickly building 2 cemeteries, one in the northeast of the city, and this will be used for a long period of time, so that the people do not have to beg for their loved ones to be buried. This is a pandemic that nobody was prepared for, and right now in the world there is no one who can receive the living nor the dead.
However, those who live in the Monte Sinai sector in the northeast of the city have rejected the construction of a cemetery in their area.
At such a time, all they can think of is building a cemetery. Despite knowing that there is no water, people have nothing to eat. They are dying from hunger. They want to build this cemetery to fill the area with containers full of bodies that they have here in Mount Sinai.
Members of the Monte Sinai Citizens Observatory say the location of the cemetery could affect the residents.
We have a natural water stream that when it rains, it overflows and generates damage. They want to build a cemetery next to the channel. It would affect us. I propose that a cemetery is built in another area where there are no houses and it can be built with greater security.
Meanwhile, the government said that it is undertaking several visits across the country, verifying that all protocols are being followed and supplies are delivered in different areas. Despite this, there are several complaints about lack of medical supplies in hospitals.
The Cuban Ministry of Public Health this Saturday reported 56 new confirmed COVID-19 cases, including 55 Cubans and 1 foreigner, for a total of 620 cases. Director of Epidemiology at Cuba's Health Ministry, Francisco Duran, confirmed that out of the 55 new positive cases, 46 were contacts of previously confirmed cases, 7 were contacts of people who had travelled abroad, and the source of the infection for 2 cases is being investigated. He explained that there were 31 confirmed asymptomatic cases, and in this regard, he reiterated the need to comply with the measures adopted in the country, specifically social distancing. Cuba's COVID-19 death toll currently stands at 16.
Out of the 620 confirmed cases, 513 remain stable. Unfortunately, today we have to announce the death of 1 person. That adds up to 16 deaths due to the COVID-19, bringing the fatality rate to 2.6%, while 77 people have been discharged from hospital.
Since the first moments of the triumph of the Cuban Revolution, efforts have been ongoing to guarantee free healthcare for the entire population. This guarantee is one of Cuba's major strengths in the current context of the coronavirus pandemic. More details in the following report.
During these hard days of the coronavirus crisis in the world, these images are only seen in Cuba. More than 25,000 medical students visit several Cuban houses every day to identify possible new COVID-19 cases in the country.
People are really grateful, especially because we are not only visiting them to care about them at home, but also meeting them to convey a message of security.
They're called active inquiries and are usually performed by the island's primary healthcare services, an essential layer of its health system. Cuba has more than 100,000 doctors, which means 9 for every 1,000 Cuban. In 1984, they founded a family care program with 1 doctor for every community, an experience that has established an example internationally.
This structure is Cuba's biggest strength, a structure that has long years of development with better capacities over time, trainings, resources that will allow them, as we have seen in its initiative, that hundreds of youth, students of medicine and odontology, they are doing home visits, they are inquiring the home visits.
In spite of the shortages and economic damages caused by the U.S. sanctions, the Cuban government guarantees free health care to the entire population and provides support to other nations in the world.
For more than 50 years, we have been collaborating since the year 1963. More than 450,000 health professionals of different generations have fulfilled a foreign mission in which 1,900 million people have been assisted, saving more than 7 million lives.
Another successful example here is biotechnology, one of the most dynamic sectors in the Caribbean country. About 20,000 workers from different research centers is the leverage of this thriving industry that is already quite fruitful. The Cuban drug interferon alpha-2b has proved it to the world, used to combat the new coronavirus.
The Cuban interferon has more than 30 years of revision. There is a lot of experience regarding other diseases. We know about the impact that has it, improves the immunity of patients, and in this case, I believe that it will also provide in the care of cases with coronavirus.
Doctors and no bumps premise that Cuba defends and supports now sending 596 health specialists to more than 14 countries affected by the COVID-19.
We are an army of white coats, willing to share our knowledge, with the goal of saving lives anywhere in the world.
In the middle of the campaign, full of lies to discredit the island's medical collaboration with the world and the pandemic that has shown the fragility of the health systems of some developed countries, Cuba strengthens this essential human right with solidarity as a premise and guarantee of life over capital.
And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss and thank you for watching.